Okay, good morning, everyone. I'd like to call this meeting to order. Today is March 6th, 2026. This is the Eastern Shore delegation. We could rise for the pledge. I pledge allegiance to the flag of the United States
of America
and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all. Delegate Sample Hughes, could you offer a prayer to the group today?
Yes, thank you, Mr. Chair. For those who would like to, please bow your head. Father God, we come to you this morning with open arms. Thank you for another day to do the work you have called us to do. I am grateful to those who have assembled to listen, to learn, and to execute plans to make things better for your people. Our world is hurting right now, and only you have the answers. We give you all the glory. Amen.
Amen.
Thank you, Delegate Sample Hughes. Members, could I get a motion and a second to approve the minutes from February 27th?
So move.
I need a second.
Okay. I'll second it. I'll second it.
I don't know who that is.
Larry Walton from Eastern Shore.
You have to be a member.
Oh, okay, well, I guess I'm not. Sorry.
All right. Well, we'll come back to that later.
I second the motion.
Oh, thank you, Barry. All those in favor say aye. All those opposed, motion carries. Members, good morning. We have Senator Chris Van Hollen on with us, and it's a pleasure to have you, Senator, and the floor is yours.
Well, thank you, Chairman Adams, and it's really great to be back with you and the Eastern Shore delegation to Annapolis. And let me just start by thanking all of you for your good work. You get a lot done within 90 days. I wish I could say the same of the Senator of the House of the Representatives, but really, we share the same constituents. And I just want to say at the outset that anytime that you need assistance at the federal level, please call me. Please call members of my team. Alyssa Hastings is here with us, our ambassador on the Eastern Shore. And the head of our Maryland office, Ashima Talwar, is also here. So let me just touch on a couple issues and look forward to any questions or comments that you may have. And I do want to, there is a lot of division in Washington and throughout the country, and I think we all understand that. But I do want to focus on a few bright spots, and that is that this year, this fiscal year, the Congress did pass a fresh appropriations bill. That was not the case last year. We ended up operating under what we call a continuing resolution, meaning we just put the previous year's budget on automatic pilot. But this time we were able to fund all agencies in the federal government, with one exception, as I'm sure you know, which is the Department of Homeland Security, where there are a number of very unresolved issues. But the good news is in the other areas, we were able to fully fund a number of programs. And when I say we, I mean this on a bipartisan basis. For example, the agriculture programs, federal agriculture programs, so important to the whole state, but especially the Eastern Shore. We were able to provide robust funding for those programs. The Chesapeake Bay Protection Program, which of course is essential for the health of the Bay, which is essential for the health of the watermen and the boating industry and the tourism industry. We were able to fund all aspects of that program. And again, the original budget that had been submitted by the administration cut many of these programs, but on a bipartisan basis, we were able to restore funding, in some places, depending on priorities, expand them. Because we have a fresh budget, we were also able to secure funds for a number of important local projects on the Eastern Shore. These are projects that were requested by either municipal governments, county governments, nonprofits. And so Senator Alsterbrooks and I and Congressman Harris worked to secure about $70 million for 25 projects on the Eastern Shore, trying to fill gaps, usually one-time funds to help a municipality or a fire department or emergency department. So, for example, I was just on the Eastern Shore last week at the town of Barclay. We were able to secure $1 million to help them buy and develop a community center and town hall. For those of you who've been there, and I know many of you have, they have essentially a little shack which currently operates as the town center. And the town believes, and we agreed, that it'd be important to support a community center there. Also in Kent County, where the headquarters of Kent County's emergency medical services are, we were able to provide funds for a backup generator. Obviously, if you're doing emergency work, it doesn't help to have the power cut when you need to be responding to emergency. So those are just a couple of examples. As I said, they were 25 altogether. I was also visiting Caroline County because Senator Cardin and I in years past got about $2 million for the Benedictine School, which does very important work for people with disabilities, intense disabilities, and they have an amazing workforce there who are caring, and it was great to be out there to visit. Another example would just be $2.7 million for the town of Hurlock for their wastewater treatment upgrades. Again, I'm not going to go through the whole list, but you get a flavor of it. I will say another category that we were able to support were the Army Corps of Engineers dredging programs, which are obviously essential for commerce on the Eastern Shore, parts of the Eastern Shore. And another $20 million for Ocean City beach replenishment. Hard to have Ocean City without the beach. Not many tourists would be coming. That, as you know, has been funded through the Army Corps of Engineers in large part. So that was through the appropriations bill. We've also been pressing the administration to release the funds for broadband, right? The broadband program, when we passed the bipartisan infrastructure modernization bill years ago, we prioritized expanding access to high-speed internet everywhere, but the biggest challenge, as all of you know, has been in more rural areas. And so Maryland is due about $267 million. I'm on the Appropriations Committee. I'm on the subcommittee that oversees the Department of Commerce. I'm the ranking Democrat on that committee. And we had a bipartisan hearing. Senator Moran from Kansas, the chairman, we were able to bring the Secretary of Commerce, Secretary Ludnick, before the committee, and we are continuing to press them to release those funds that are so important to individuals, families, small businesses on the Eastern Shore and really throughout our state. Turning quickly to agriculture, as all of you know, avian flu has hit the poultry industry very hard. So we continue to work to secure resources through USDA and the APHIS program to respond. In a couple of years ago,
The rest of that back there.
a couple of years ago, APHIS provided about $13 million in indemnity to Maryland, poultry farmers and operations. We are working to try to expand that kind of emergency insurance coverage. The Farm Bill would be the vehicle for doing that. We're working with the Maryland Farm Bureau and others. The Farm Bureau did pass the House of Representatives just this week. We're still working to get it through the Senate Ag Committee. On the seafood side, I know all of us know that our watermen have faced adverse weather and market conditions this year, and especially in the impacting the oyster harvest and oyster prices. So Team Maryland, as we call it, Federal Team Maryland, but also State Team Maryland, has pressed the Department of Commerce, U.S. Department of Commerce Secretary Ludnick, to approve a fishery disaster assistance plan for Maryland's oyster fishery. We're also working on the blue catfish issue. Congressman Harris and I teamed up. We secured $6 million in funding to help expand the processing of blue catfish. I remember, I think it was last year, the year before, going out to the shore and seeing just, all of you know just how big these have gotten, but they're also good eating. And we know we got to eat our way out of this. So we want to improve processing, the speed of processing, but also address other bottlenecks in getting blue catfish to market. We were also able to secure $2 million from USDA to help purchase more of these healthy proteins for school lunch programs and food banks. So that's an important piece of all of this going forward. We're also trying to deal with unfair trade practices from the Venezuelan crab imports, which are undercutting Chesapeake Bay crabbers and damaging the reputation of our industry when people get confused as to exactly what kind of crab meat they have. And finally, I will say, when it comes to especially the crabbing industry, we need the H-2B visa program. We've had to deal with this from one administration to the next. I'm glad that DHS did announce that they would maximize the number this year. It had been originally proposed at 35,000, but it's been boosted to 64,000+. But we still have this lottery process, which is not the smart way to go about allocating these visas, especially when you have an industry like the crabbing industry that is so time intensive. We don't want people literally having to have a lottery to determine whether or not they're going to be able to attract the workforce that they need for their operations. And the success of those operations are directly related to the success of other parts of our Maryland economy, including the restaurant, some of the restaurant industry. So we're continuing to work on a bipartisan basis to pass what's called the Save Our Seafood Act, which would be to essentially carve out an exemption for the seafood industry from other limitations on the H-2B visa program. A lot more to talk about, but let me stop there because I look forward to any questions, comments. Let me end where I started. Really, thanking all of you for the work you do. Obviously, we'll all have some disagreements on some issues, but I know we do try to focus on how we can work together for the success of the state and for the Eastern Shore. So great to be with you.
Thank you for your service to our state and to our country, Senator. I thought you'd want to know that we have, I think, a record number of people on the Zoom call is like 85 to 90 coming and going. So a lot of attention to this particular presentation. Delegate Jacobs.
All right. Thank you, Mr. Chair. Good morning, Senator.
Good morning.
You mentioned the seafood issue just a few moments ago. As you know, we've been wrestling with this USDA FDA issue for quite some time. Is there any movement you think in changing that from USDA inspection to FDA in any of these efforts?
Yeah, Delegate Jacobs, we continue to press on that. We've had a challenge over the years, and Congressman Harris and I have both worked on this with respect to some of the southern states, blocking the ability to transfer the sort of inspection and review process from USDA to the FDA. But we're continuing to press on that. But in the meantime, what we've done, and we're seeing growing success from this, is helping the the producers and the processors get more support so they can expand their operations. And that has been successful. And we're continuing to press to expand those efforts even further, which is, as I mentioned, the $6 million we secured for processing. I was out on the Eastern Shore, not that, maybe a couple of years. I mean, I've been there many times, but to Tillman Island, where they have a number of processing. They have a processing facility for blue catfish. So we have a sort of two-pronged strategy here. We'll keep pushing on the issue USDA versus FDA, but we're in the meantime, making sure that people have the resources to expand processing operations.
Yeah,
And to have the market and to have the markets, right? As I
Yeah.
mentioned, we're also working on making sure there's a market for schools and for food pantries.
Yes, sir. I appreciate that. And I know that $6 million is certainly going to be very helpful in trying to offset some of this invasive catfish. There is so many in the Upper Bay right now, heading to I think they're heading to the spawning grounds where the rockfish are going to be spawning, but there's hundreds of tons of blue catfish in the Upper Bay right now, and that's not a good thing. It may very well have an effect on the striped bass hatch, which we've had some issues with in the last few years anyway on a juvenile index. But we need to have all means necessary to try and curb some of this because, as everyone knows, there could be catastrophic consequences if this blue catfish continues to promulgate the way it is in Maryland. So anything you can do to help on that end of that processing side, I know it's been a challenge, but we'd never give up. How we are on the shore. The other thing is, I want to briefly mention that you brought up the reaching out to the Secretary of Commerce on the oyster disaster issue. I know the governor sent a letter on February 27th, and I think Congressman Harris sent one, I believe it was on February 3rd. So, but you have not heard anything whatsoever.
Yeah, we've collectively sent a letter, but we've not heard back yet. I'm told it's under review, but we didn't. We haven't heard one way or another yet. So anything, as a delegation, if you all are interested in putting together also a request underscoring the importance of that relief, that'd be great. Maybe you've already done that, but
Well, we sent a letter on January 30th to the governor from the Eastern Shore delegation, but these guys need help as quick as possible. It's really been a tough year. There's it's been one of the toughest years I've ever seen. So I know they need disaster relief sooner than later, and I appreciate anything you can do to help. Thank you, sir.
Well, thank you.
Delegate Aaron's.
Senator, welcome. It's good to see you. Let me preface this. I'm not here to start a controversy, but it's something that's on everybody's mind, and you've been in the forefront of this. And it's about immigration. And as we both understand, immigration is an issue in the country today. And you've been out there pretty good on it. You've been voicing your opinion. But I guess for the people out here, could you help us understand what is being done at the level to get some resolve on this, to actually come together and figure out a plan? And I don't want to make it political, and I know it is, but I would hope that in both chambers, people are looking at this and with real eyes and sitting down and saying, this needs to be addressed. This is a division right now. And as I said, you're probably one of the guys that's talking about it a lot, and I appreciate what you're saying. And I know it is your version of it, but can you help us out briefly? And again, I don't want to start a
No. I'm glad you raised this. And let me just break this down into a couple pieces. I think this is unfortunately one of the whole issue of how we deal with immigration has been one of the big unresolved issues for many years. And not to go back in ancient history, but I remember almost 20 years ago, there was a bipartisan bill that came out of the United States Senate, Senator McCain, that had important border security components, and I've always been a strong supporter of border security, but also had immigration reform measures that would have provided a pathway to legal residence for people who'd been here for a long time, productive citizens, people who'd been obeying, productive members of the community who'd been obeying the law. Anyway, that passed out of the Senate. There was a big bipartisan victory, over 65 votes, I think, out of 100. Never got a vote in the House of Representatives. So that's my background, because this has been an ongoing issue, as you know. So fast forward to today, the Trump administration said that it was going to focus on what they described as the worst of the worst. And nobody disagrees with the idea that, people who are here, who are not here illegally, who have been involved in committing crimes, obviously they need to be held accountable. But what we've seen is not targeted just on the worst of the worst, right? It's been really a mass deportation effort. It's creating huge disruptions in communities all over America. I'm sure you're all aware of the pastor from the Eastern Shore who was.
Senator, I apologize, but I don't want to get into that. I want to know what we're doing, and I apologize because that's where the controversy comes. What are we
Okay,
doing?
well, what do you ask? So if you're
Well,
asking about DHS,
yeah, I
are you
know.
talking about DHS funding?
No, I'm not talking about. I'm talking about what is the Senate and the Congress doing to sit back? We know what the stories are out there, and that's why I said I didn't want to do that, because that comes partisan, and that's not where I want to be. I want to know what today. There has to be conversations going on in this. There have to be conversations between Republicans and Democrats on how to fix it. We know what's happened, and I think that's where people start getting heated. What have you done but in the Senate? What are you doing to fix it today? Not what happened. We know that, but what are we doing to fix it?
Well, I've been involved in discussions for years and remain open to discussions to go back to the template that we had when we were moving forward on a bipartisan basis to both ensure border security, but also have a comprehensive immigration reform plan. But I know you don't want to get into politics of it, neither do I. But the Trump administration is not supporting that.
Well, but you guys are. The Trump is that, but the Senate Democrats and Republicans have to be sitting down saying, this is an issue. We're moving forward. Here's some suggestions, and this is what we're talking about. Even in subcommittees, we do that here, and we're divided.
Well,
anything solid we can tell our constituents? This is what our federal representatives are doing to help resolve this problem, because as we just talked about, we can say Trump did this, I did this, Biden did this, and I don't think that's what's really happening at your level.
I don't disagree with you that we should have federal legislation. This is not a partisan statement, it's a fact. I mean, the president has said he doesn't need or want any legislation. He has said that he can do it alone. I mean, he's made a big point of that. And that means, at least for now, Republicans on Capitol Hill have deferred to the president. They're not engaged in these discussions. I hope we can get back to them. But again, the president has said this is his thing, and he's going it alone. He doesn't want any.
Well, okay, I'll end it with this, because I know this is tough. Let me just say this. Even in my world, where we're fighting for energy issues, we have major problems here. We have our paths that are all going wrong. We present legislation, we present ideas, and we continually go forward. And I know we have both sides of that. I just want to say that. And I'm a little saddened that this isn't happening at the level that I hope it was happening at, because it does affect all of us. But I do appreciate it. I know it's a difficult subject.
Well, thank you. And speaking of energy, I'm hoping we can get bipartisan agreement on containing the huge increase in electricity costs that we're all facing. I pulled together a Maryland delegation meeting yesterday where we had chairman of the Maryland Public Service Commission, the People's Council, the Maryland Energy Administrator, and the lead government outreach guy for PJM, which, as you know, is the grid that Maryland operates under. And I've introduced legislation, speaking of trying to fix a problem, called Power to the People, which would make very clear and put into law provisions to make sure that all of us and our constituents don't foot the bill for increased costs from data centers, either the additional power that needs to be brought to the grid or the additional transmission costs, because my view is that Marylanders and no American actually should be subsidizing the costs for data centers that, as you know, are pretty much owned and run by the richest companies on the planet. They should cover their costs completely 100%. So since you mentioned energy, I thought I would mention that because we just had our delegation meeting yesterday, so it's fresh on my mind.
But thank you. I appreciate you. Thanks.
Thank you. Thanks.
Delegate Sample Hughes.
Thank you, Mr. Chair. Good morning, Senator. Thank you so much for being here. As always, I appreciate the work that you are doing for our constituents. I wanted to just first foremost, thank you so much for the 2.7 million for Hurlock. I know they've been working a while to try to get that upgrade there with their wastewater treatment facility. So that's certainly a conversation that they can feel a little bit more comfortable with as we meet with them and as we go along. I wanted to just highlight two things for you. I'm starting to get phone calls now with regards to the TSA workers, and I know you have mentioned about that carve out, specifically the fact that Homeland Security budget is affected. Do you foresee any movement at all specifically for the TSA workers? And I did direct one of the citizens to your office, and I spoke with your staff last night, but just wanted to flag that for you. The last one I'll flag is yesterday in our Government Labor Elections Committee, which is a new committee in the House, we had a bill, House Bill 1543, and it deals with the temporary workers. You had mentioned that this morning. The Farm Bureau, the seafood industry are not in favor of the bill, but what the bill is trying to create another unit for the temporary workers industry to oversee some of the challenges that the people testified on yesterday, was the environment that they're working in, some regards to surety bonds. And I know we already do that at the federal level, but they want to additionally do that at the state level. But overall, it was like the health and welfare of the workers. So I just want to bring that to your attention, as that's a concern that was raised, but just wanted to see at all, could I talk to someone from your staff to figure out what is really being done at the federal level, and how to, if anything, if necessary, it needs to be done at the state level.
Well, Delegate, good to see you, and thanks for your work, and thanks for raising those two issues. On the second one, please make sure that Alyssa gets the information regarding your proposal. Obviously, we want workers to be treated fairly, so look forward to getting your thoughts on that. On the first one, I'm glad you raised this issue. So as I mentioned, the Congress has now funded all the federal agencies except for DHS. And the issue there has been an ongoing discussion with the White House about the need many of us believe to make fundamental reforms in the way ICE is operating. We may have disagreements, but obviously, if people witnessed what was happening in Minneapolis, we had concerns. Maybe the administration had concerns. As you know, yesterday, Secretary Kristi Noem was left. But it's my view that the other parts of DHS, so that's TSA, the Coast Guard, and FEMA, they should receive their full funding to continue their operations. I mean, there's no reason that they should not continue to operate as we discuss changes to ICE, right? Reforms to ICE. So that is my view. Just yesterday, Senator Patty Murray of Washington, who's the ranking Democrat on the Appropriations Committee, asked for what we call unanimous consent in the Senate to do that, right? To free TSA and FEMA and the Coast Guard, so they wouldn't be caught up and delayed in terms of providing funding, and that was blocked, the request for unanimous consent. So we're still in a place where we're continuing these discussions. But I agree with you. I agree with TSA workers that there's no reason that they or those operations should be, penalized, not funded. I mean, as you know, they're all working because they're essential workers, but they're not being paid. And the only silver lining here is because of a bill that Senator Cardin and I passed years ago. When we finally reopen TSA, they will get fully reimbursed, but that doesn't help when you're going day to day without a paycheck.
Absolutely. And thank you for certainly acknowledging that, because they're talking, about the mortgages being unpaid. And but thank you. I didn't realize I forgot about the Coast Guard, but you're right. The entity as well is really.
Coast Guard and FEMA.
And
Both.
FEMA as well. Okay.
Yeah.
Thank you again. Appreciate it.
Thank you.
Okay, Senator, I know you had a 9:30 hard stop. Do you have time for another question or two, or shall I?
I can do one more, and then happy to get back to others if you want to submit questions. Yeah, I'm heading down actually your way to Annapolis. I've got an event. We actually have a good news announcement in Annapolis too. So.
Well, let's do this last question. I'd ask it to be brief in respect to the senator's time. Delegate Beecham.
Yeah, it will be very brief. The H-2B visa that you were talking about, Senator, you said that you were going to try to get an exception for the watermen or for the crabbers. Could you also include farmers in that? Because we've got a couple of large nurseries on the Eastern Shore that they bring seasonal help in, and I would really appreciate it if you could include those in that exception.
Well, thank you, Delegate. Happy to look at it. This has been it's been very delicate, even trying to get a carve out right for seafood. In the state of Alaska, years ago, got a carve out for fish roe, right? Fish eggs. And we're trying to expand that to like all fish and seafood. It's just politically been very difficult to even get that, but we're happy to engage in conversations with you.
All right.
And thank you. Thank
Yes.
you all very, very much for what you do, and appreciate the chance to connect with all of you.
Okay, very well. Thank you very much, Senator. Have a good day.
You too.
Okay, members, next up, we have the Eastern Shore Behavioral Health Coalition. Good morning.
Good morning, Chair Adams. On behalf of the Eastern Shore Behavioral Health Coalition, we thank you and all of your Eastern Shore delegation members and representation for welcoming us year over year to provide our updates for our priorities for this session. We have been so pleased to be able to present to you all. I think this is going on our 15th or 16th year of our coalition. So for those of you who are not familiar, we are a group that represents all 9 counties of the Eastern Shore, several providers on our Eastern Shore, as well as local behavioral health authorities, local addictions authorities, and we have individuals as well with lived experience and community members that are interested. So it is an open group that stays very well connected over the course of the year, and especially right now during session, we love to have this opportunity just to lift up how our behavioral health services and some of the proposed changes and impact with budget hit a little bit differently here on the shore. So we really appreciate the time to present this morning. We have offered a very lengthy handout this year for your reference. Several of the items that are included in today's presentation handout, we have included in the handout only. We won't be speaking to because we know we have limited time with you this morning, but certainly wanted to lift up all of the areas of our priorities for your awareness. And certainly want to just reinforce the availability of our coalition to be a resource and support for you all as you are working through the last several weeks of session. I know several of you have reached in along the way already this session to get a pulse on what would this look like for the shore. And we appreciate you using us as a resource, and we hope that after this morning's presentation, you will continue to do so. And we welcome questions as well. We have several of our members that will be speaking this morning, and but certainly would love to have some Q&A at the end of our presentation if time allows. So thank you so much. So going in order of our handout that we have provided to you this morning, I think the number one priority that we want to lift up this morning is the sustainability and the support for our behavioral health provider network, not only here on the Eastern Shore, but this is an issue across the board. We will be going into some more detail just around how the workforce crisis looks and our concerns around sustainability of services in depth here in a moment. But we really wanted to just take an opportunity, number one, to thank several of you who have been a staunch advocate of supporting our behavioral health services and our network here for several years. Several of you were around in 2017 when we lifted up the first edition of the Keep the Door Open Act, which was a multi-year installment of a provider rate increase that supported not just our rate increases for our mental health and substance use providers, but also allocated funding to support our grant-funded programs here in the state of Maryland. And over the years, there were increments ranging from 1% to 3% of an increase that were built into that bill, which were extremely beneficial and provided a real guiding light, I think, for those of us in the provider space as well, to know that there would be opportunity to continue to have enhanced reimbursement, because we know that things are not getting any cheaper in terms of supporting our workforce and just operations, but the needs are growing. The demand is there, and our providers are really in a position where they need that support and really deserve to have an increased rate year over year. Unfortunately, given the budget climate, we are now in the second year of a budget that has a proposal of no increase across the board, which is very concerning. So we want to take this moment just to advocate for your support where you can to really highlight the need for our behavioral health service providers and our grant-funded services to have an increase this year in the budget. We are hoping for a 3%, but certainly I think if anything, we want to sustain what we have, and we would welcome any level of additional support. So we really want to just start there with sort of setting the stage with our hope for your support. And with that, I'm going to hand it over to our partners who are going to speak on our child and adolescent services. So we'll be hearing from Jessica Toole with Caroline County Health Department and Rachel Stoyanov, who is a team member here at Midshore Behavioral Health supporting our consortium on coordinated support. So I will hand it over to you two.
Thank you, Katie. Good morning, everyone. Thank you so much for having us. I'm Rachel Stoyanov, and I'll share a little bit about the consortium program. Midshore Behavioral Health is proud to be a part of the CHRC's Hub program. We return this year as a full community support partnership through Maryland's Consortium on Coordinated Community Supports. A part of Maryland's Blueprint for Education, Midshore Behavioral Health has served as a local behavioral health authority for the 5 counties that comprise the region: Caroline, Dorchester, Kent, Queen Anne's, and Talbot counties. The purpose of the CHRC program is to expand the access to comprehensive behavioral health and wraparound support services for Maryland students and their families. This program has established community support partnerships across the state, and to date, 100% of the state is receiving support in one manner or another from this funding provided here for novel behavioral health and substance use interventions for youth. Midshore Behavioral Health has been a part of the planning for this hub-spoke model. used to provide these resources since its inception. Across the Midshore, our hub has been constantly engaged with the counties we serve and with their local education agencies to sift through 36 applications we received across the region. Some were small businesses, some providing proposals that will deliver critically needed one-to-one therapeutic support. Other counties felt the need to empower parents and provide access to telehealth and web-based services and filled that identified need. Of the 36 applications we received, after consulting with the LEA, the internal staff, and then our board of directors, Midshore Behavioral Health has endorsed 17 applications to move forward this year in service to our students.
Hi, good morning. I'm Jessica Toole. Last year, the entire state budget for this specific program was $100 million. This year, they are proposing to reduce this by $20 million. As a state, this project has done so much for students in Maryland, and it has grown partnerships and community resources. As we move forward, the goal of the project remains to assist all public school students in receiving the necessary supports, regardless of income, insurance status, or location. However, with the current budget proposal, many of these programs will have to be pared down and/or cut. For the Midshore, $8 million has been requested for these programs to support in FY27. Today, suicide is the second cause of death for children ages 10 to 14 in the United States. Students face challenges that previous generations have never dealt with: social media, online bullying, COVID, the death of parents due to drug overdoses, school shootings, etc. While also still experiencing the expected struggles of adolescence. It is estimated that over 20 million children in the United States have a mental health condition. We must continue to support the needs of our students, which cannot be achieved to this level without this funding. In our region, we are committed to the services of all of our residents.
When I work with families, I often tell them that asking for help is probably one of the hardest things to do. The hub functions as an open door, a compassionate response, and knowing that there's no wrong way to ask for help. We are available to open doors for support and service to families, but also to the grantees that we're supporting. Our region has the benefit of nationally renowned programming like the Cook Center for Human Connection, which provides web-based solutions for lots of concerns, and they are training local mental health champions that start a ripple in this area. We're also really happy to have a sister act among us. Striving for Wellness Together in Queen Anne County is a small business where identical twin sisters started off as local school-based providers and have, through the guidance of this program in our local behavioral health space, become a cornerstone of behavioral health services on the shore. So we're excited to support that effort. In school year 2027, we are excited to bring new voices to the table that are both technologically and culturally up to date to reach those and serve in a way that addresses the needs that they've expressed. We must remember that the children are our future. We must remember that it's so hard to ask for help, but we're earnestly asking for your help today. Please support the full funding for the Consortium on Coordinated Community Sports in the fiscal year 27 budget. Thank you.
Thank you. Now we're going to hear from our leadership from the University of Maryland Shore Regional Health System. For our leadership in the behavioral health space are going to touch on how they're supporting our child and adolescent population.
Good morning. My name is Amy Hoffman, and I'm the Director of Behavioral Health for Shore Regional. And we are here this morning as to talk about the University of Maryland Shore Health. We have worked very collaboratively to welcome the opportunity to explore how our system of care can be a resource for expanding services for the child, adolescent, and young adult population on the Eastern Shore. We are continuing to explore outpatient service expansion and formalizing partnerships with providers already existing on the shore to meet the needs and fill the gaps in care for this very specialized and high needs population. Shore Regional Health is committed to supporting wellness across the whole lifespan for our community.
Thank you, Amy. So now we will hear from Kathy Castle with Channel Marker on workforce.
Good morning, everybody. I'm Kathy Castle. I work for Channel Marker, and I'm the CEO of Channel Marker, and we do community behavioral health services in the Midshore. So I'm going to talk about workforce, and a couple of us are going to speak to that, but I'm particularly going to talk about the crisis that we're all in, and I'm sure that that's not uncommon or something we hear in every industry. We go to a restaurant, we know there's not enough workforce, there's not enough healthcare providers. All industries are struggling with their workforce. But what I will say, I'll just get to the bottom. I like to go to the end and then come back, work back. But I'm from the Eastern Shore. I've worked at my company for 35 years, so I've seen a lot of ups and downs in our industry, but something just hits a little different since the pandemic. Also really concerned because analysts say that it's predicted by the year 2028 that 45% of our clinicians are leaving this field for a variety of reasons. Retirement, they can't take it anymore. Maybe moving to a virtual platform that pays a lot more than we're all able to pay. And we're very concerned because at the end of the day, if we don't have enough workforce, obviously the clients that we see in community services are going to need higher level of care, and that's going to hurt our state budget even more because incarceration is already full at capacity, full of people with mental health issues. Hospitals are very full, and already probably our new hospital doesn't have enough beds that it probably wants to have or needs. So we're worried about the flat funding. We understand all of the issues with the state budget, and we know there's no magic wand, and we know that everybody needs and wants funding. But honestly, we can't pass on the cost of what we do to our clients. They're some of the most chronic illness, people with most chronic illness. Our clients live in poverty across behavioral health. And, if you look around on the Eastern Shore, there's much more unhoused people than I've probably ever seen. And we're just really concerned because our workforce is burned out and we can't pay them what they need to live. And it's just getting really difficult. So flat funding is difficult. We understand why the choices are hard, especially at being legislators and having to make these choices. But we all partner together. If you're on the shore and you're a provider, we like to think we're all very unique on the Eastern Shore. I do think we're unique, but we all partner together. We have no choice. We need each other, and we all have the same struggles. It's not just one of us or two of us. It's all of us. And sometimes we're recycling the same employees that only stay for a couple years, but we do need some help, and a consistent, predictable Medicaid increase, like Katie had spoken to, would really be helpful in any form of increase. Thank you.
Thank you, Kathy. And I know we'll be hearing from our leadership team this morning under a separate agenda item from For All Seasons. I know they're here this morning and we're excited to receive your presentation, but just to put in a plug as well related to licensure and credentialing and all of the regulatory pieces that our providers are up against to maintain operations. One thing that we just want to really lift up is that any way that we can support efficiency in our licensure processing, regardless of where they enter or what they're asking for. We're involved at the local level to support our providers in that process, but we have a true concern around where it's getting stuck in the processing system. Just at the state level, it's created several hardships for providers that are well established, have been in the system of care for several years, and for our new providers trying to get in to fill gaps and needs. We really hope that any opportunity to leverage your support around how we can create efficiencies and consistency in that space, we really appreciate it. So sorry to kind of jump off the agenda script there, but I wanted to make sure to plug that because it's something that this group is very passionate about and has been impacted by as well. So now I'm going to hand it over to Dimitri Kavathas to talk about CCBHCs and the amazing work and support they bring to our community.
Hey everyone, Dimitri Kavathas, CEO of Healthport. We are a certified community behavioral health clinic. This is a repeat message from last year. I had a chance to talk to Delegate Beauchamp and Delegate Hartman. I think I wrangled Delegate Adams for a second in the hallway, and I got some staff from Delegate Sample Hughes' office as well, and Delegate Aarons's office. The CCBHC is a legislative mandate to the department to establish a financial structure just like a federally qualified health center. So if you look at a Chesapeake Healthcare and a Chop Tank, we are trying to establish that for behavioral health in Maryland. And we're trying to get it going, not just for Healthport and other organizations that are currently grantees as a CCHC, but really for the behavioral health system as well. So we're going to be the pilot probably for a rural certified community behavioral health clinic. But the department has changed two things in language and the BRFA. So once again, it's in the weeds, all the way in the back. No one knows. And they've changed language from shall to may. And they're trying to push this thing from FY 27 to 29. So we just need support to tell them no, just keep the language the way it is, allow CCBHCs to pursue a demonstration for Medicaid so that we can catch up. We are 10 years behind. This is across the country. There are billionaires like Mackenzie Scott and the Ballmer Foundation, Steve Ballmer, putting $73 million and $29 million into this across the country because this is so important. And it would be great if Maryland was a place where those billionaires could think that Maryland would support this, but they didn't choose Maryland because the department continues to fight this. So we need your help. You'll hear a lot about money being spent, but we've given you data here. And I can tell you at Healthport, for example, we decreased the length of hospital stays by 40% once we intervened with very difficult chronic health condition consumers. And we also reduced hospital care, psychiatric care by 68% and hospital costs for physical care by 36%. So we are saving significant money. That is not my data. That is not our data. That is the state of Maryland's data. Their state of Maryland's telling us we're doing this. So please disregard the numbers that you're hearing from the DLS assessment. Please change the language and please help us catch up to the rest of the country. Thank you. I don't know how to.
Thank you, Dimitri. So now we will hear from our leadership for our Eastern Shore Crisis Response Services to highlight and update the group on all the amazing work that's happening to support individuals in crisis and to prevent crisis here on the shore. So Tina Brown.
Good morning. Thank you for this opportunity to talk to you this morning. Affiliated Sante Group is the largest behavioral health crisis provider in the state. We serve Caroline, Talbot, Dorchester, Wycomico, Somerset, Kent, Queen Anne's, and Cecil. So as Maryland moves further into a fee-for-service environment, we respectfully ask for your continued support to maintain our crucial grant funding that allows services to operate effectively, especially in our rural communities. Medicaid reimbursement alone is not sufficient to sustain our crisis services here on the shore. We have lower call volumes, longer travel distances. Our staffing costs make the fee-for-service model financially unsustainable for us. We'll always need some other type of funding to assist us to support these services. To ensure that every Marylander can access timely life-saving crisis care, we also ask for your continued support for the 988 telecom fee, which you supported last year and we really appreciated. It provides dedicated, stable funding for Maryland's crisis call centers, which we are the backup center for life crisis, which is here on the shore. And we are also a backup 988 center. Behavioral health needs across Maryland continue to rise, particularly among youth and families. Crisis services provide intermediate, cost-effective, and community-based interventions that prevent unnecessary hospitalization, reduces 911 involvement, and keeps our individuals safely connected to the community resources. Our goal is always to try and keep people out of the hospital and connect them with community resources and help them utilize their natural supports. In the first 2 quarters of FY26 this year, We've handled 4,268 crisis calls with our call center, completed 7,028 follow-up calls just to ensure that clients are safe. We've completed 548 mobile crisis dispatches for our youth. We've responded to 407 dispatches for adults. We've diverted 174 clients from the emergency department, which reducing avoidable healthcare costs and the ED burden, because we all know how overburdened the ER is. Each number really represents a stabilized crisis, a family supported, and a life kept safe. Cuts to our crisis services, whether it's through Medicaid or federal reductions, will have an immediate statewide impact. We believe we'll see higher emergency department utilization, increased calls to 911, which involves law enforcement, greater risk to our individuals entering the crisis or the criminal justice system instead of receiving the health care that they really need. And of course, then that adds into higher long-term costs for hospitals, counties, states. It hits everybody. Investing in crisis services reduces strains on Maryland's most expensive and overburdened systems. We appreciate our legislators' continued commitment to support our behavioral health services and your continued support for the 988 telecom fee, which directly sustains all of Maryland's crisis centers. Thank you.
Thank you, Tina. And the last item we're just going to touch on this morning for the presentation so we can allow time for a Q&A is around assisted outpatient treatment. As several of you have been involved with this discussion for the last few years now, back in 2024, Senate Bill 453 was passed, which was the mental health bill for the implementation and the establishment of assisted outpatient treatment programs in the state of Maryland. Certainly the Eastern Shore Behavioral Health Coalition has been very involved and connected to that piece of legislation since its inception, and has been very intimately involved with some of the planning that's gone into how that will look here on the 9 counties of the Eastern Shore. It's been an interesting journey. We've had a lot of intentional and thoughtful conversations on what will this look like here on the shore. As many of you know, one of the original requirements in the bill was to have a local response by January 1st of 2025, indicating whether or not counties would take on the primary responsible role of implementing what an assisted outpatient treatment program would look in the county or in a regional model. After a lot of consideration and deliberation, all counties in the state of Maryland, as you know, I'm sure, decided to defer to our state-led partnership to be the primary entity for implementing this model. Through several discussions and meetings, and many of those that we have hosted out of the Eastern Shore Behavioral Health Coalition space, as well as with our Eastern Shore Provider Network, have really advocated for a rollout of what this could look like across the state, and have always been a willing partner to try anything really on for size to see if we can figure out efficiencies and ways that we can leverage our partnerships to support new programming. Out of the department's planning, there have been 3 priority regions selected for the implementation to go live as of this July 1st, 2026. In the state with the first installment of this model. So the Eastern Shore, all 9 counties, we are one of those 3 priority regions. The other 2 are Anne Arundel County and Baltimore City. So those of us in the local authority space that are represented this morning, we have been very intimately involved with some planning meetings with the state. Especially recently, we have a special priority 1 region group that's been convening. So questions have been coming in fast and furious about what is this going to look like here on the shore. There's still a lot of planning that will be put into play with the department's leadership. So as soon as we know exactly what it's going to look like here on the shore, we will be happy to share. We are actually in the active process as we speak with working to collect a cohort of leadership and interested providers here on the shore to have a meeting, hopefully in the next few weeks, with the department to have a more intimate discussion on what the implementation and model can look like here on the shore. But one thing I did want to lift up this morning, and I know several of you have already expressed interest in having a conversation around, is the language that's included in this year's Budget, Finance, and Reconciliation Act, which does appear to put the onus of the responsibility of the funding of this program back to the locals by FY31. I think we have, an interest in discussing concerns on what this could look like here on the shore. I know several of you have already reached in to say, Katie, what do you know about this? We have not been at the table for that piece of the discussion, but certainly I think all of us can agree with our original pivoting to the state to support the implementation of this model. Certainly welcome your thoughts around how that would potentially impact us locally, and realize that it's complicated. I'll just say that. So wanted to make sure, I have a feeling you all have been discussing this piece of the BRFA, but wanted to make sure that you know that we're tuned into it as well and happy to be at the table for further discussion. And I'll just stop there with our presentation so we can allow time for questions. And like I said, in our handout that was sent out to you all, there's a lot of great information, some different areas of opportunities for advocacy, and just touching on some of the work we're doing across the board with our overdose prevention initiatives, suicide prevention, our homeless services, as well as a couple specific bills that we wanted to make sure that you were aware of. But with that, we just, again, thank you so much for the time today. It's always a gift.
You're very welcome, and it is a gift that you give us to be here. I've been with delegation for 12 years now, and we've always enjoyed your timely updates. These come at the right time, and we're definitely getting ready to look at the budget and get into budget season. So thank you for both your service, the service of your allied partners and service providers, for what you do for us on the shore. It has not gone unnoticed, as you surely understand. I'm not seeing any questions from members, but I did have a question for Kathy Castle, because we talked about the workforce development part. As a small business owner myself, I can relate to the general principle that employment and getting people to join up and do these important jobs is more difficult, not less difficult. I'm not going to say it's impossible, but even in good times when budgets are okay, it's still difficult to get the employment numbers that you need to provide service. So when I was reading your notes here, where your workforce is burnt out, I just thought I would ask the question: do you see a pathway forward as it relates to doing this with more efficiency? Or we talk in my committee, Economic Matters, about AI and some degrees of how we are doing things differently over time, and certainly that's an employment conversation. But I think I'm asking a generic question that gets to, how do you see the next 2 to 3 years, understanding that the budget in the state of Maryland isn't likely to get any better, as I'm reading your notes. So thought I would just ask you through the lens of me being a business owner and how you see the same thing.
Well, I think I would say a lot of other providers are using telehealth and those kind of platforms to be able to be more efficient, or to get people that even work for other states. But I guess what I'm speaking to is just the grunt work, just in the trenches, and that probably is more of, we're doing psych rehab, a lot of us, the crisis services that Tina talked about, where it's people to people, so you have to be there, you have to do that, or we're taking care of people in residential type of services. And, I have not thought of a more creative way to get people to do those kind of jobs, or to have better crisis, skills or coping skills or problem solving skills. It's a different workforce out there. And I don't know. I don't have the magic answer right now. I mean, we have no choice. We have to move forward and people have to be cared for, but it is difficult. And I think there will be closures. I really do think that there'll be some agencies that are forced to close and some services that will be forced to no longer exist. Because when you're just down on the front line, hospitals have to staff units, residential services have to staff, and you know that. I'm not trying to speak,
When you say a workforce is burnout, though, that's heartbreaking, because I think what it says is that you have plenty of people that care a great deal and are willing to do the tough jobs, but they can't do it themselves. And that message back to Annapolis should be some degree of it's taken us a while to get here. And I think I'm reading from your points here that it's taken us a while to get here, and to fix this is going to take it a while to kind of bring us out of it. And you've got an acute problem right now, and that is a workforce shortage. And you're right, at some point something breaks, and breaking is entities that can't provide the services any longer. And I hope your testimony is you're not seeing the in your front view the breaking of the system. But I think our message up in Annapolis and to the budget committees is that I think we've reached this point, and having heard these meetings over a great number of years, this has always been sort of a emerging topic of concern that I've picked up. I'm not on the committees for health and budget, so some of the bills you're talking about are focused and narrowly tailored. I'm just thinking of it as a employer who you're trying to have an entity perform services, and that's your message is one that I can resonate with, is my observation there. So.
Well, I know, and I'll just say one more thing. I know we need to be quick, but and we've taken hospitals down, and that's a good thing. I'm not saying people want to be in hospitals or we want to keep people in hospitals for 20 years like we used to when I first got into this business, but that means the severity of those clients are in the community. So, which also makes it more challenging for people to want to do that kind of work.
Right. Katie, I'm not seeing any questions, which is okay. I thought I'd give you your last word, and again, thank you for the presentation today, and it's timely information that we should be able to use as we're completing our session this year.
Now, I'll just take the opportunity again to thank you all for your support and leadership of our coalition. We've had some big wins over the years, and we really appreciate you locking arms with us to advocate and support and lift up the voices of the providers and our community members that are benefited from these amazing programs that are represented this morning. And it's just we really hope that you pause when the discussion comes up, and say, I might stop and give Kathy a call or Tina a call, or any one of us. Really, we're here for you. This is a team effort. I think it's been mentioned many times already this morning that we always step in and partner on the shore in a different way, and we just greatly appreciate your leadership and representing us in your roles. So thank you, and we really just appreciate this opportunity every year to join you and keep you informed of how things are looking in this space for the shore.
Okay, great. Thank you very much for your time today.
Thank you.
Okay, members, next up, we have Jonathan Rondo with Fellow. Good morning.
Good morning. Thank you for your time this morning. Riley Shoebridge is going to share a PowerPoint, and we'll get started. Riley, you can move on to the next slide. So Fellow has been, we're celebrating our 65th anniversary this year, but for the over 25 years, we've been providing services on the Eastern Shore. And we do that in 4 distinct ways: supporting people with disabilities through services, where we're helping people live, work, and connect with their community; where we're supporting people with disabilities who choose not to get services through a provider, but hiring their own staff through self-directed services; We do provide behavioral health specifically for people with intellectual and developmental disabilities that also have a mental health diagnosis, and we have a behavioral health suite in Easton. And then what I'm going to speak most to you today is around fellow communities, which is our housing work, which is the area that has the biggest growth on the Eastern Shore. So fellow communities is focused on infill projects and focused on mixed income properties. And that the reason we do that is we believe we were founded on the principle of creating equitable and inclusive communities and services for people with disabilities. And we want those pieces to be relevant around housing. And so all of our housing is a mix of market rate, accessible, and affordable, with market rate being between 70 and 75%, and then the accessible and affordable being between the 25 and 30%. We have a number of projects happening in Easton, but what makes us different before I dive into them is that we do not build specific affordable units. Every unit looks the same. We're really focused on infill parcels, so we're not taking sort of former farmland. We're taking, so in Easton as an example, 2 former Purdue silo sites and reimagining what they can be. We also don't develop to sell. We are the long-term property holder of those. And then we have a robust process where we really work with our tenants and their partners around to avoid eviction. And so I'm happy to say we have yet to evict a tenant. We have successfully either mitigated it or found alternative living before a tenant had to be evicted. And so that's something that we're particularly proud of. Moving on to the next slide. So one of the questions we often get is how do our funding work? Well, so while we don't do LIHTC tax credits, we use traditional bank financing and then a mix of equity and government grants. So we use other projects to help fund future projects, as well as sort of government and private grants and fundraising that help support the other 30% of those projects. Move on to the next slide. So I'm happy to say that one project is near completion. So at the end of March, we will be completing the Laura House, which is on August Street in the historic district in downtown Easton. So we took a former 8,000 square foot empty site, and now it will have 7 units in that. It will be mixed income. 2 of the units will be for people of moderate income. 1 unit will be designated for TIS, for people exiting homelessness, and then the other 4 units will be market rate. The first tenants will be moving in on April 1st, and then we already have 2 units that have been pre-leased by prospective tenants. So really exciting to take a former blank site and to create something that's useful for the community. The next project I want to talk about is Silo Court. So Silo Court is the former Purdue silo site that was a 2.5 acre site off of Needwood Avenue. This will be a 28 townhomes, 7 of which will be for workforce housing. They'll be a mix of 3 and 4 bedroom ones. Around that, site work has already begun, and the first we anticipate going vertical later this spring around that, with first tenants moving in early fall. We will be moving people in as each grouping of townhomes are completed. So tenants will move in between October 2026 in July 2027, around that. Easton Crossing, which many of you have learned about, is the larger, which is what usually people know, and people have noticed that the silos have come down on that site. That's a 6.5 acre site off of Brooklets Avenue, where the rail trail bifurcates that. And so this will be a 5 building project that will include about 119 units, of which 40 will be some level of affordability. There will be artist lofts in one of the buildings. There will be universally designed units in 2 of the buildings, and all the units will comply with ADA accessibility. Around that, the first site work will begin this summer with the first building starting to go up in later this year, and then this project will be going through 2030. One unique thing about Eastern Crossing, it will include about a almost 2-acre pocket park that the public will have access to that will be right off the rail trail. The commercial space, there'll be about 24,000 square feet of commercial space. The commercial will be facing the rail trail. We hope to announce the first tenant in the next month or so. We do have a signed letter of intent for the first tenant on this site. And so we have a couple other renderings for people to see. This project has completed has full approval through the Planning Commission at this time. We're also excited to say that working with the town of Denton and the mayor there, we are under contract on 2 sites there to expand inclusive housing. One of those sites will have a version of the Laura House there, so a mansion style building. But we're excited to expand both market and affordable housing in the town of Denton. So more to come on that in the near future. And then just wanted to give a perspective of our existing properties on the Eastern Shore. The Eastern Shore has been the area of growth on our housing the fastest. And so this is just an overview of the number of units that we are currently managing particularly across the Midshore. As we look to the future, Salisbury is an emerging market that we're looking at of how we can expand. And we've had some conversations with some groups in Ocean City about opportunities to partner there around housing. So with the piece that I'll just sort of underscore for Eastern Crossing, the governor did include in his capital budget $2 million that will support the infrastructure that's necessary at Eastern Crossing. And so we would hope that as we go through the legislative process that money would stay in the budget for that important project. So I will end there and open up to questions.
Okay. While we're waiting for questions, I want to thank you, Jonathan, for meeting with the Eastern Shore delegation a week or 2 ago and in a more informal setting, and appreciate your work that you do for us in the state. Could you just briefly describe the progress that you're making in Easton and how you see the region over the next 5 to 10 years through the lens of your organization? Of course, you're showing us some of these projects, but as we think about budget and we think about housing priorities, the reason why I ask is I serve on Economic Matters Committee, and we now have housing as our subject matter, and these are acute problems that the governor and the administration under DHCD are leading on, trying to make change. And so my question goes more to, while you don't involve yourself in LIHTC or HUD-based programs, certainly the state of Maryland, DHCD does do that. So I'm trying to figure out how you
So there's a
partner. Yeah, go ahead.
Yeah, that's an important question, right? And so I think there's a couple of things to know. Part of the way that we were founded 65 years ago was around how people with disabilities can be fully included. And we believe that whether it's people with disabilities or low income, that if you're creating inclusive housing, that housing you're building can't be majority for that population. In Maryland, to qualify for a LIHTC deal, the ones that get awarded are primarily anywhere from 70 to 85% for a specific population, people coming out of homelessness, people with disabilities. And while we believe that there's a value in that doesn't align to the way that we look at how we would see that in the community. So that's number one. Number two, we save about $100,000 per unit by not taking government LIHTC deals because we don't have the same requirements that are baked into that, both from the federal and state level around that. And so it is actually in the long term, because we hold these projects, it is the debt is actually easier for us to manage around the pro forma because we're not doing that. And then the third is an average LIHTC deal from site development and when you're applying to when you're cutting that ribbon averages about 10 years. The average length of any of our development is about 3.5 years. So we also believe that there's a sense of urgency in the need for quality housing, accessible housing. And so those are some of the things. We do believe that there should be a viable option. Just for us, we want to play a role in a different way and provide a different option and a different way to do development across the region.
You look and feel more like a private developer in that you can deploy faster. It looks like you're using traditional forms of leverage with banks. And to that end, I appreciate the fact that you've got a mission-driven focus that allows for sort of this mix between, helping a population at the same time doing it in the traditional way. I find that interesting and compelling as a private business guy myself. So
yeah,
I'll give you the last word, and doesn't seem we have any questions at the moment. So.
Well, I really just appreciate people's time, and we please reach out. We'd be happy to show you these projects as they're coming along. And if similarly as you finish up the legislative session, if there's any support or questions that fellow can answer, we'd be happy. Please just reach out to myself or Riley Shoebridge, our Director of Government Relations. So thank you very much for your time today.
Okay, thank you for being with us. Members, our last presentation today is For All Seasons. Our dear friend Beth Ann Dorman. Beth Ann, if you're on, the floor is yours.
Good morning, Chair. Thanks so much. And for everybody, it's great to see you. Just wanted to touch base with you on a few things that are happening at For All Seasons. As a general reminder, For All Seasons is the Behavioral Health and Rape Crisis Center that serves all 5 counties of the Midshore region: Kent, Queen Anne's, Caroline, Talbot, and Dorchester. Last year, we served over 4,000 clients and provided over 150,000 services. One of the things that has become really important for All Seasons is making sure that when we are providing services, we're digging in ways that are creating sustainable processes and working across. I can't echo what Kathy Castle said more, that when you work on the Eastern Shore, you have to do it better together. There's no sort of siloing of the services that we provide. And so this really, some of what I'm going to speak to is not just about For All Seasons, but it's really about the way that we work on the shore. Specifically, what I'm asking for support on and favorable votes for are 2 bills that we have co-authored with Delegate Tom Hutchinson, that's also been sponsored by Chair Adams and Senator Johnny Moutz. We have historically, we've been coming to all of you over the last few years, trying to shift laws that really do impact not just the Eastern Shore, but the entire state of Maryland. And we've been really thankful that in the last 2 bills that have been put forth with Delegate Grist, that we've been able to change some laws. This year, what we're asking for is your support on House Bill 922 and Senate Bill 702, which is changing the regulations of how programs are able to expand. As you know, we have been expanding our offices in all of your counties. And so we just expanded offices in Kent County and Chestertown. Within the last few years, we expanded our office in Denton. Now we just expanded our office in Cambridge, and we are in the process of finishing renovations on buildings in Talbot County. What we are running into is, once we have submitted our application to the BHA for moving our office down the street, it is sometimes between a 6 and an 8 month wait, where we are paying double rent, where all of our offices are turnkey ready, but we are being forced to apply through BHA as a new entity. We're about to celebrate our 40th year on the shore. We're in good standing with BHA. And so really what this comes down to is we're asking for your support to change the process, because what we really need is a change of address form. Specifically for our Cambridge office, it was 8 months of paying double rent, being ready to roll. And it took a phone call from Senator Moutz to be able to move the application forward when we were only moving literally 3 blocks away. And so we're asking for your support to really help this process be more streamlined. It's costing us resources. It's costing our team a little bit of angst to know when are you moving to a new office. And certainly for our clients, we want to create the continuity of care in terms of services. The other bill that we've put forth with Delegate Hutchinson and the support of Delegate Adams and Senator Moutz is looking to be able to have required reimbursements for master's level interns that are under the supervision of LCSWCs and LCPCs, or our licensed clinical social workers and professional counselors. Right now, we are able to bill Medicaid for master's level interns that are working underneath our supervisors. Our private insurance companies are resisting the ability for us to bill for these services. I think it's really clear after everything that we've heard on the call from the behavioral health providers that when funding is level, the onus becomes back on us as providers to figure out how to pay for things, expand services, take care of our teams, and take care of our staff. This will allow us to be able to be reimbursed for the services that the interns are providing. We don't get any reimbursement from universities when we have a contract with them to have interns in our agencies. I can speak for For All Seasons specifically that we have traditionally been able in the last few years to be able to provide a stipend to our interns, because in this market, we recognize that asking a graduate student to come in and work for 20 hours a week for no pay just doesn't work. And so what we're really looking for is continuity of care across both Medicaid and private insurance companies. So we're asking for your favorable vote on that. I think the other piece that just continues to resonate as I've listened to everybody talk this morning, especially as I listen to Jonathan talk about the number of housing units that are coming into the community. One of the things that we really need to be paying attention to is that mental health is sometimes thought of in the reactive mode. And a lot of what we're talking today is about the proactive, thinking about the fact that when watermen are struggling, and Delegate Jacobs, the topic that you talked about with everything that Senator Van Hollen was responding to, if watermen are stressed, it's a mental health issue. When we're looking at people who can't afford housing, it's a mental health issue. When we are looking at folks who are in crisis, these are mental health issues. And really what I would ask on behalf of everyone that works on the Eastern Shore in the capacity of a mental health position is that we're not looking at mental health separate from health. As the hospital is expanding, there has to be a place for folks who are being discharged to come into this region. I can speak for our agency specifically that when I came to the agency 12 years ago, we were serving under 800 people. We're now serving 4,000. And we could hire more staff in the clinical social work and professional counselor work if there were more staff to hire. Right now, we employ just under 40 clinicians, and we have 5 psychiatry team members. We see everyone from children to adults. And so when Jessica's talking about the increase in suicide, especially within our child population, these are the things that as a delegation, we're asking you to please be paying attention to on the front end, because if we can start to put some proactive systems in place where every time there is consideration to a bill or a problem within our community, we are saying, and what about the mental health of? It would be a game changer for us, because when Kathy's talking about the workforce struggles, one of the things that becomes back on us is how do we figure this thing out? And Chris, or Delegate Adams, I loved your question around, tell me what this looks like. For our agency, what it looks like is we're adding in more holidays to our schedules. We're talking about how do you do self-care for your team. We're talking about how do we shift the workforce culture where people can have balanced lives when we are seeing some of the tough cases that most people in our communities don't have to think about and or don't do that work face to face every day. So, clearly we're here today to ask for your support on the 2 bills that we've co-authored. But I also just say to you as a delegation and as someone who works for an agency that's been on the Eastern Shore for 40 years, right alongside of the rest of the partners, that I really believe we have an opportunity to start to talk about mental health differently across all sectors, because at the end of the day, if we can create these systems that put mental health in the front of some of these problems, I truly believe it is something that will help change the outcomes, reducing so many of the challenges that we're facing in the mental health community.
Okay, Beth Ann, thank you very much for your presentation. We do have a couple questions. Delegate Grice.
Yes. Well, first, before my question, Beth Ann, I'm very happy to see you back in action here, and our thoughts and prayers are going out to the battle that you're facing now, and you look great. I just want to say that first of all.
Thank you. Great to be with you all.
Yeah, and then and keep up the fight. So my question is, this licensed graduate bill, is this the same issue that we've been fighting on 2 other occasions, or is this something a little bit different?
This is a little bit different. So the bill that we had co-authored that was signed last session was about getting the licensed graduate professional counselors and the master's level licensed clinicians who have graduated from their programs to be able to bill private insurance. And that's the bill that passed last year. This is about the master's level students that are still in school, but they are in our office as part of the regulation to be able to graduate. They're in our offices. They're under supervision of licensed clinical professional counselors or licensed clinical social workers. We can bill Medicaid for those services. We are not allowed to bill private insurance companies. And I will say that we've worked directly with Matt Salatano, and he is in support and favor of this bill.
Okay, and currently, are the insurance companies paying our licensed graduates who are out of college? Are they actually following the law this time?
Perhaps some, not all.
Okay, and is there a penalty involved if they don't, that you're
No.
aware? Right, maybe that's the next step, possibly for next year. Okay, thank you, Mr. Chairman.
You're welcome.
Delegate Hutchinson. Delegate Hutchinson.
Delegate, I think you may be muted.
I'm sorry. Here, I'm here. I was muted. Thank you. So Beth Ann, nice to see you. For those that are on the call, the bill that she was referring to, House Bill 1094, which is the graduate level clinical interns. Beth Ann and I worked during the interim with the League of Life and Health Insurers on this bill and got them to be supportive of the bill. In the last week or so, there's been a number of other entities who have been. I'm off. Can you hear me? Yeah,
I can hear you, buddy.
I'm good. Is that I've had a number of requests to amend that bill to include other licensures, other settings. They're not going to be accepted. The league has come back and said this year we can move forward with what you've asked for, and has requested that if anyone who was interested to amend onto this bill come back to me next year, and we can talk on a case-by-case basis and then involve the life insurer. So if anyone's thinking to continue the amendment process, we're not going to be able to do this. We have to make sure this gets through this year for this area. That's it.
Okay, thank you very much. And Beth Ann, I'm not seeing any more questions. This was a wonderful kind of a team effort of presenting, the issues of the day for our allied partners, and we do appreciate kind of you batting cleanup and sharing your message. And without any further questions, I'll give you the floor to have the last word.
I would just say that as we continue to be in some really tough times, both in our communities and in our country, it's meetings like this that make the difference, when it's human to human contact, when we can really sit down and talk about the issues and the behind the scenes and the stuff that's in the front. I just, on behalf of everybody, I know I can certainly speak for Katie when I say, like, the time and energy that you all put towards us and make it feel like we are not on the Eastern Shore, but really truly a part of the state of Maryland and not separate is so important. And so thank you for all the work that you do, and thank you for all your time and energy to make us better at what we do.
On behalf of the entire Eastern Shore delegation, thank you, and also thank the team that presented today for multiple organizations. God bless each one of you. All right, members, next up, we have our federal updates. Why don't we start with, well, Alyssa Hastings.
Thank you, Mr. Chair, and thank you for the presentations earlier. Just wanted to reiterate that our portal is continuing to be open. As Senator Van Hollen mentioned this morning, those are the applications that we're taking for the funds like the Herlock wastewater treatment plan and like those other congressionally directed spending projects that he mentioned on the call. Kimberly and I are taking joint meetings until up and through next week. So portal is open until March 15th, and we look forward to conversations. That's it. Thanks.
Just hang loose for just a minute. I'm gonna let everybody go through, and I want to talk about our meeting on Monday at Blackwater just briefly. I didn't get a chance to talk to Senator Van Hollen about it because he had to get off the call. Next up, Kim Cradaville.
I think it's hard to follow the U.S. Senator, so just what Alyssa said, that the portal closes on the 15th, and so if you'd like working with local governments and nonprofits. So thanks. These are always great. Thank you all.
And Congressman Harris's office representative on today.
Yes, this is Jackie Gregory. Good seeing you guys. Just really quickly, our art competition is up on our website at harris.house.gov, and deadlines for submissions is Friday, April 24th. You guys already got an update on the DHS situation, but the congressman did say that there are negotiations currently happening between Democrat leadership and the White House. The congressman voted against the War Powers Resolution, which called for stopping our joint military campaign with Israel against Iran. He supports Operation Epic Fury and the goal of ridding Iran of its nuclear weapon and long-range missile capabilities. He says the president is within his rights under the War Powers Act to conduct this campaign for 60 days, and then after that, it would need congressional approval. We're still trying to push for the Senate to pass the Save America Act, which passed the House recently. The bill would require proof of citizenship when registering to vote and a valid ID when voting. It also requires states to remove non-citizens from existing voter rolls. Currently, we're busy working on the FY27 appropriations, and for the next few months, we're going to be very busy with appropriation submissions and various hearings. And as always, we're happy to field federal issues from your constituents that reach out to your office. And that's all I have.
Right, great. Thank you very much. And listen, Kim, you and I and a couple of other members of the delegation attended a meeting in Blackwater. My question is there anything that the delegation can do to communicate to the right channels, the issues? And I also see Mike Detmer on as well. Anything that we can do as a delegation to advance those interests that we heard, and maybe just briefly give us an update from your perspective as to what that meeting was on Monday, and frankly, how we can partner with the federal government as a state delegation.
Absolutely, sure. So we attended, a number of us who were on the call, Kimberly, Mike, Chair Adams, Delegate Hutchinson, were attending a meeting on Monday at Blackwater National Wildlife Refuge in Dorchester County. And during the conversation, a few of the farmers mentioned the need for having more flexibility along the what pesticides and chemicals and what kind of seeds the farmers could use for having a cooperative farming agreement be able to happen on refuge land. They're really concerned about deer eating their neighboring crops as well. And so we heard from the farmers. We did actually have a follow-up email this week. I know Kimberly and myself both heard from one of the farmers, and so our offices are both actively looking into the issue at this time. And I see Mike has his hand up, so I'll also defer to Mike too.
Mike, go right ahead.
Thanks, Mr. Chair. I can say, wearing both of my hats, that the Dorchester Council on Tuesday did authorize staff to put together a letter to go to the federal delegation, to go to the refuge leadership, and I will ask them to ensure that this body receives that letter as well.
Okay. So what I'd like to do is on top of the efforts that you're making, because this is a federal issue, I'm going to try to get a motion from our members to write a letter and in our words, share what we heard during that meeting and the importance of sort of advancing the interests of the Blackwater Refuge through the lens of cooperative farming and other items that help, basically the mission of the Blackwater Refuge, which is to increase the, waterfowl and wildlife. And, a lot of this comes down to providing the right kind of food mix, and non-GMO plants can sometimes be difficult to manage as a farmer. So that's the crux of the matter. And we'll try to get a movement on delegation to do that. And thank you for being there on Monday and engaging on the subject. It seemed very important to our farmers in Dorchester County, as Tom and I, and certainly Johnny, understand. Okay.
Can I just reiterate, Mr. Chair,
Sure.
I'm sorry, with
Yeah.
regard to that, with the letter that might go, and just a reiteration of, the relationship that we have, the great working relationship with the refuge. I know that came up as well. So
We are big fans of the folks there at Blackwater, and we want to see nothing other than helping them move forward without a doubt.
Right.
Okay, members, Delegate Rice, you said you had something you'd like to bring up?
Yeah, I do. Actually, I have some good news. Do we need to vote on that letter, Mr. Chairman, or?
Let me think about how to go about that.
Sure.
I probably do, but let me think of how to word it, because we'll do that as a voice.
Yeah. Okay. Yeah. So it's great that that we can end this meeting on a high note. Maybe this might be something we want to consider doing each week if we can present some good news. And I do have some actually for the Eastern Shore. I was late for the meeting this morning. I was meeting with our chairman, appropriations chairman Ben Barnes, and he was our District 36 team for Jay. I don't know what the last 8 years or so. We've been trying to help Kent County build a middle school by increasing the state share, because there's only 19,000 people and they have to pay for half the cost of a school, and they desperately need a middle school. And we've tried, I don't know, a half dozen, 8 different iterations of different bills over the years, and we just couldn't get anything to actually move. The committee loves it. They love the idea of, but it never worked. But working with Alex Donahue, who is the CEO or director of the Interagency Committee on School Construction, has a fix for us. Now they have to vote on it next Thursday, so I can give the delegation details, but it looks like the state share will potentially increase for Cecil, Queen Anne's, Wycomico, Dorchester, Caroline, Kent, and Somerset. So we have some collateral benefits from the work that we've been working on for the last 6 or 8 years, and so it looks like most of the counties on the Eastern Shore are going to benefit from that. So that's great news. And it looks like some of the counties will actually be funded at 100%, which is amazing. So that's great news. And then of course the CAFO moved this week. That's also great news for our Eastern Shore farmers. And it looks like the NEO-NIC bill is dead, right, Jay? So this has been a good week for us. I just want to make those announcements.
Good. I like this. We'll have to add it to the agenda, the good news agenda.
That's right. That's right. We can all use some, especially on Friday.
Absolutely. Senator Carozza.
Thank you, Mr. Chair. It's good to see everybody this morning, this fine Friday, and to have good news. A couple of updates. Several of us on this past Saturday attended the DDA Save the Services rally at Pohanka and Salisbury. And I have to tell you, in my time of public service, it was one of the most emotional and moving meetings to see the individuals with disabilities, their families, and their caregivers really just put out there not just the devastating impact of the proposed DDA cuts, but also to really in detail go through and explain to us how broken the current system is. We had one nurse, Kristen Forster, that in detail, she's a nurse vendor in self-directed services since 2023, in detail explain this convoluted process, of trying to apply and stay on and to continue to provide services, that ended up forcing her making a difficult decision to leave DDA and drop her self-directed families, and that was affecting 10 families. And then she goes on to testify at the rally about 90% of the DDA nurses are leaving DDA as a result of this broken system. Now, what she did, which we can all admire as a delegation, she went on and she didn't just complain and criticize the system. She actually offered several detailed ideas explaining how the system could be improved. And at the very end of her testimony in her letter, she said the entire DDA system needs a complete overhaul. With that, and knowing that although all of our delegation members could not attend Saturday's meeting, but are completely committed to working on not only restoring the cuts, but to see how we can improve and reform the system. I wanted, and I know we have Delegate Hutchinson on the key committee of jurisdictions and others well positioned. The thought was to take the information from the rally and, as an Eastern Shore delegation, call on this new Maryland Department of Health secretary and the governor's staff, and to not only focus on the proposed restoring the cuts, but specifically calling on the reform of the system and include the ideas of the people on the front lines that can tell us how the system should be improved. So I would move, and I would present to share to with the delegation just a draft so we're all seeing what could be presented to the secretary, and that we move forward in force as a delegation and make sure we're on record that we're aware of the broken system, but we're also sharing ideas on how it could possibly be improved. Be happy to, have Delegate Hutchinson and others who attended speak to this, but I wanted to bring to the delegation what I thought the follow-up should be at this point.
Okay, thank you for your leadership, Senator Carozza, on the subject, and sorry I couldn't make it. It looks like Delegate Hutchinson has his hand up, maybe wants to add a little bit to that.
Well, I really concur with Senator Carozza on everything she said. I was glad I was able to be there. And I think she does bring a good point up that we should probably write a letter for that. Just as we close out, with the sake of time, I think we have in front of us potentially 2 letters that the delegation can and should write. So I'd like to, I guess, some degree, make 2 motions. One is the motion in terms of the letter for the DDA support, and then the second is a letter for the cooperative farming issue that is at Blackwater, that the delegation
writes
that letter.
Let's take up the DDA, and then we'll pick the other one up. Senator Mounts, I saw your hand go up.
I was going to concur.
Okay, so members, we have a motion and a second to write a letter regards to the DDA and funding difficulties that are in the budget, along with some narrative that relates to Senator Carozza and the meeting that we had on Saturday. So will all those in favor please say aye?
Aye.
Aye.
All those opposed? Okay, Senator, our office will work directly with you, and you can direct us to other members who might want to participate in that as well. But to get it done quickly, we'll just start with you in that regard. Delegate Hutchinson, could you make the motion on that same letter? And
so now let's make a motion to write a letter regarding the cooperative farming issues at Blackwater.
Okay, I need a second on that.
Second.
Okay, members, for writing a letter related to Blackwater Refuge and cooperative farming, which is an acute problem in Dorchester County, for which the Eastern Shore delegation will be communicating with the federal partners, because that is a federal wildlife reserve. All those in favor say aye.
Aye.
All those opposed? Okay, and Delegate Hutchinson, I'll work with Senator Mounts and you to draft that letter, along with Delegate Sample Hughes. This is a Dorchester County facility project, but certainly is a regional asset, so we'll work on that directly. Members, anything else for the good of the order? If not, I need a motion and a second to close proceedings.
Motion to adjourn.
Second.
Okay. Members, have a good day, and we'll see you on the floor.